Hello, I'm Christina and welcome to my channel. So I filmed a first trimester update video last week, even though I'm well into my second trimester right now. And then I looked back on it and it was awful. I was just in a bad mood, really grumpy, but I decided I wanted to change things up. Instead of just talking about me and how my first trimester went, I wanted to make it more about you watching this video. Things that I think that you should know about your first trimester, things that I didn't know, and they kind of came to as a surprise to me. I have 17 things here that I want to share that I think you should know about being in your first trimester.
Just a little disclaimer before we get started. I am not a doctor. Please do not take anything that I say as medical advice. Please consult your physician if you have any questions about your personal situation, your health. This video is only for entertainment purposes and should not be used as a replacement for medical advice.
I'm in my second trimester right now. I'm 22 weeks pregnant as of filming this video. I lived through my first trimester, so I'm going to share the things I think that you should know based on my personal experience, obviously. So yes, I'll be talking about myself, but hopefully making it helpful for you as well. So let's get started. First thing I think you should know is you think that you're showing, but you're not. So I remember when I was like even 8, 9 weeks, I was looking at my belly and I was like, wow, I'm looking pregnant. First of all, I was bloated, so bloated. And I remember looking back at clips even when I was 4 weeks pregnant and thinking, oh my gosh, there's a little bump here. And now that I'm 22 weeks pregnant, looking back, I'm like, there was nothing there. I had a flat stomach compared to now. So yeah, you think you're getting bigger, you think that other people can see your bump and you look pregnant. You don't yet. You're not, especially if it's your first baby. If it's your second baby, things start to show a lot sooner. Yeah, I didn't show as soon as I thought I was showing. Even I was looking back at 10 weeks, I'm doing like a little video for myself to look back on belly progression. And I was looking back at 10 weeks and I was just like, there was nothing there. And I thought I looked pregnant at that point. And you're gonna feel a lot bigger than you look to other people. Number 2, I felt really stupid. And I'm hoping that I'm not the only one that went through this. But basically, your first trimester goes on 2 extra weeks than you think it would. Before you get pregnant, you're like, okay, pregnancy is 9 months. So that means the trimesters are 3 months each. 4 weeks times 3 is 12 weeks. So I go on my pregnancy app once I'm 12 weeks pregnant and I'm like, oh, it's going to tell me I'm in my second trimester. Maybe the nausea will go away. Maybe I'll start feeling more energized. Because that's what everybody says. In your second trimester, the nausea goes away and you start to feel more like yourself. So I was counting down the days, the minutes, the hours until I turned 12 weeks, looking for some sense of relief. And then I go onto the pregnancy app and it's like, you're almost there. You're almost out of your first trimester. And I'm like, what? What do you mean I'm almost out of my first trimester? I thought that the first trimester ended once I turned 12 weeks. 4 times 3 is 12. No, the first trimester ends at 14 weeks. Why? Because pregnancy isn't 9 months. It's 10 months long. It's 40 weeks long. So, or at least that's how the doctors measure the pregnancy. So I was sitting there very disappointed that I still had 2 more weeks of this terrible nausea, and I will get into that later. But yes, your first trimester ends at 14 weeks, not 12 weeks. So if you're counting down those days, like I was, you're gonna be very disappointed if you think it's gonna be over at 12 weeks, because it's not. Number 3, a lot of people know this, yes, but you will be nauseous and you will probably vomit at least once. So for me, I had, a mild, or still have a mild form of HG, which is very severe vomiting and nausea. I was never hospitalized, so that's why it's a mild form of it. Some women get hospitalized for it. I was very lucky, but I think it's like some crazy percentage, like 80-something% of pregnant women get nauseous, get morning sickness. You would think that, it would come on right away and then it would subside gently. For me, it didn't. It got worse. It got really bad at 6 weeks and it just kept going, and it got even worse at 10 weeks and even worse at 13 weeks, and it just kept going. Expect it. If it doesn't happen for you, then you are so lucky and you should really just thank your lucky stars. if you don't experience the nausea and vomiting. My mom didn't. A lot of women I speak to just get nauseous and they're able to control it with like candy or tea, but that's not for everybody. So plan for the worst. Expect that you probably will get nauseous and expect that you will vomit at least one time. Number 3, in the time that you are at your sickest and you should be able to use pregnancy as an excuse to not do things. You're not telling people that you're pregnant. Some people tell people in their first trimester. For us, we decided to wait. Some people wait till 12 weeks to tell their family because that is the time where you're significantly reduced risk of miscarriage. We waited until I was 14 weeks because we wanted to get some test results back and make sure everything was normal and everything was going well. At the time where you're gonna need to use your pregnancy as an excuse the most because you feel your worst, you won't be able to. You're not gonna be able to help people understand why you're being such a useless lump. That's what I felt like, a useless lump. I wasn't able to do anything. I was just so sick. It's a backwards system, in my opinion. Number 5, cravings are not what you would think they are. I think her channel's called Beauty by Christy. I think it's Christy. She has a really, really interesting story. She's currently pregnant, I think. But I heard her share this little tidbit about cravings, and I was like, yes, that is exactly what it is. It's not like, oh, I just really feel like having ice cream right now. That's not what it's like. It's like, nothing sounds good. Nothing. You're like, do I have pasta? Nope. Salad? Nope. Sandwich? Nope. Like, nothing sounds good to you. And then you get this like one idea, or like you see something on TV that looks good and you're like, yes, like tomato soup, for instance. You're like, I have to have that. I have to have that. Nothing else sounds good but tomato soup. I can't eat anything else right now but that. And you have to have that one thing. And that's what, for me at least, and I guess for Christy, who shared that information with everyone, that's what pregnancy cravings are like. The cravings also don't last very long. Some of them do. Some of them last longer than others, but some of them are like an hour. And then, like, once you actually get the food that you were craving, because it's not going to magically appear when it comes into your mind, you don't feel like eating it anymore. So yeah, nothing sounds good except for that one specific thing. You have to have that immediately or else the craving will go away. And actually, yes, tomato soup was one of them for me. So, number 6. Your symptoms will show up at different times. For me, the nausea showed up at 6 weeks and then never went away. A symptom that a lot of people say happened for people in their second trimester, that happened to me in my first trimester, was round ligament pain. For some reason, I had round ligament pain starting at 10 weeks. Like when I sneezed, my round ligaments, which is the ligament that attaches your uterus to your pelvis, I believe, they would hurt so bad. Sneezing to this day is just a terrible experience. For most women, they say that doesn't happen until you get bigger and you're in your second trimester. But for me, it happened in the first. So don't be surprised if things show up at different times for you than what the apps would say. Things show up earlier, things show up later. For some women, the nausea disappears at like 10 weeks and then they're okay. So you just have to play it by ear and see what happens for you. Symptoms come and go during pregnancy. Some come and stay forever, or what feels like forever. Some like the wind. Number 7. The metallic taste in your mouth will last for a long time, and it's almost as bad as the nausea itself. Now, I don't notice a lot of people talking about this. I notice some people talking about it, and then they say that it's supposed to go away at the same time as your morning sickness. But there's this taste always in the back of your throat. I have it right now. I've had it ever since I got that very first positive pregnancy test. That's how I knew I was pregnant. Was that just that taste in the back of your throat? It tastes like you're sucking on a pile of pennies. It's just this metallic taste, and it was so bad in the first trimester for me that I couldn't even, at a lot of times, couldn't even eat with metal utensils. So spoons, forks, I couldn't put the metal in my mouth. I had to have plastic, which I hate eating from plastic. It's just, I avoid that. But if I wanted to eat, I had to use plastic because the metal was just exacerbating the metallic taste in my mouth. And yes, it made the nausea worse. It was almost as bad as the nausea. So even when I wasn't severely nauseous, which was far and few between moments, I still had that metallic taste in my mouth, and it was very unpleasant. So yeah, if you're like me and you get the metallic taste from pregnancy, cinnamon gum, that's what helped me. Cinnamon gum was the only thing that helped me. Yeah, you don't want to eat too many artificial sweeteners. I had to buy the pure gum. It takes getting used to. If you're used to like Big Red and, I don't know, Trident, that like normal cinnamon gum taste, then the natural stuff for me tasted like Christmas potpourri, but it was better than pennies. So there's that. The number 8 thing I want to share with you, I'm just going to leave it very simply. Not a lot of people talk about it because it's gross. I'm just going to say 4 words. Vaginal infections and discharge. I'm just going to leave it at that. Buy yourself some panty liners, go to the doctor, get a swab, and yeah, you might need some treatment. It's a thing. Don't be surprised by it. It's very common. And the discharge in general is common, even if it's not infected discharge. So expect that as well. That's it. I'll leave it at that. Number 9, you're going to look like yourself, but you're not going to feel like yourself. So this goes back to you look bigger to yourself than you look to other people. So when you look back at photos of yourself, maybe you'll have photos of yourself in your first trimester, you're going to look like yourself. You may look a little tired, but you're not going to look any different. Other people aren't going to notice or be able to look at you and be like, that lady's pregnant, but you're for sure going to feel different. You're not going to feel like your normal self. You're going to look like your normal self. So don't assume that everyone's going to know that you're pregnant or that there's something going on with you, because you're not going to look any different than you did before. However, number 10, some random people are going to guess that you're pregnant. They're just going to know, because for some reason, people are psychic. Like my brother-in-law, my aunt, my grandma, my other grandma, like my mom's friends. For us, yes, maybe people were like waiting because a lot of people knew that we were trying. And like obviously we've been married for over years, so we're in our early 30s. People are like, yeah, they're probably going to have a baby soon. So I guess that's why. But like, you make no mention of it whatsoever. You're acting what you think is normal. And then people come out of the woodwork and they're like, are you pregnant? Not even to your face. They like ask my parents or something if I was pregnant. I'm like, how did they know? It's like contradictory to my previous thing that I said, that people aren't just going to know that you're pregnant because you're going to look exactly the same. But some people are. Some psychic people, some people with psychic powers are going to know that you're pregnant, even though you made no mention of it whatsoever. So if you're not telling people, you have to lie. You'll tell them the truth eventually. They'll understand. This is a more serious one. I thought I'd throw that in there. Something I didn't really know or think about before I was pregnant. So it's important. And it's not just for your first trimester. It's throughout the whole pregnancy. But most of the things on the don't eat list are because of Listeria. So it's a bacteria. Could generally be kind of harmless for a person that's not pregnant. It could cause maybe a little dietary discomfort, but it could be very, very harmful for the baby. So most of the things on the don't eat list are to prevent any risk of getting Listeria poisoning. Not all the things on the don't eat list, like the raw fish thing is for too much mercury. Other things are for other reasons, but things like soft cheeses, deli meat, you have to be careful with the produce that you buy. Make sure you wash it very well. You always have to be sure that you are, when you're consuming cheese and dairy, you have to make sure the milk is pasteurized. You have to make sure the eggs are pasteurized. You don't want to, I think with eggs, like eating actual eggs, you don't want to eat raw or undercooked eggs because of salmonella. So yes, Listeria. Just be careful. If anything that you eat, if there is a risk of Listeria, don't eat it while you're pregnant. And that's why. Number 12, my favorite. Your nausea is not going to just magically disappear unless you're a very lucky person. For me, I was waiting to wake up in the beginning of my first trimester one day and just be like, oh my God, I'm not nauseous anymore. That never happened for me. It never happened for me. As I said, I'm kind of a special case, even though it is like, it happens to a lot of women as well. I have mild HG. It's being managed by medication that I take. But even with that medication, I wasn't taking the strong stuff. I was just taking the kind of like over-the-counter stuff that you could buy at the drugstore. At nighttime, you take it because it makes you sleepy. That, during the first trimester, helped. It helped me to eat. It helped me to keep the food down that I ate, food and liquids, because liquids also make you puke, if you have HG especially. It's just not going to magically disappear. It might fade over time. Even with the medication, I still felt a little bit better in my second trimester. Like I have days now where I have to take medication, but I feel normal during the day and I can eat normal. You don't ever feel 100% normal when you're pregnant. For some women, I have heard that it does. They just woke up and felt better. But for most people that I talk to or have heard from, it gradually disappears. So you're going to start to feel more like yourself, but it's not going to be an overnight wake up and feel amazing kind of thing like I thought it was going to be. Number 13, don't wait to buy the pregnancy pillow. I bought it when I was 5 weeks, fairly early on, and I have never looked back. My husband hates the pregnancy pillow. I think he might be a little jealous of the pregnancy pillow because I am very territorial about it. I don't want him to touch it. I don't want him to lay on it. It's mine. And it's amazing. You're getting really uncomfortable in your first trimester. Your body is changing. The pregnancy pillow is for comfort. It doesn't help with the belly or anything. For me, it does help sometimes if I like push it under my back to prevent me from rolling onto my back. But the pregnancy pillow is just a really comfortable body pillow, and you're going to need a lot of sleep, and you're going to need some comfort while you're sleeping. So the pregnancy pillow, don't wait. Get it now. Get it in your first trimester. Get it before your first trimester. It's just amazing. I love that thing. Number 14, you may need maternity clothes sooner than you think. When I first got pregnant, I was like, I'm just going to avoid buying pregnancy clothes, maternity clothes. They're expensive, and I can wear my yoga leggings and be fine. I know a lot of women do that, and it's great for them. For me, any elastic band on my stomach was uncomfortable. There's that seam in yoga leggings that even if it's not like a true elastic band on the top of the leggings, there's always that seam, and that seam is what was pressing into my belly and making it really uncomfortable for some reason. It could have been because I was very bloated, but for me, I had to buy pregnancy leggings since really early on. And I think that's why I thought I looked more pregnant than I was, because I was wearing maternity clothes from the first trimester. If you're like anything like me, and you're just very irritated by all kinds of seams or elastic bands that are pressing on your lower belly, then you might need to get one of those full panel things that I'm wearing right now, and I've been wearing for months. And you have to get used to that full panel. So your pants are basically going to come up to your boobs. And that's life as a pregnant person. But yeah, you just have to find the kinds that work for your body. As I mentioned in my previous thing, the full panel leggings are the most comfortable for me. The full panel jeans are the most comfortable for me. The things where there is no elastic band on my lower belly at all. Now, my second trimester, I'm able to wear the under the belly stuff sometimes, but I need to really stretch it out sometimes, and it's not the most comfortable maternity wear for my body. So you just have to test things out, see what works best. Number 16, maternity underwear. Get them from your first trimester. They're amazing. And again, avoid the ones with the seam. I have 2 kinds of maternity underwear. I'll put both in a link in the description box below. They are a dream. Yeah, there's one in particular. There's no seam. There's no hard stitched seam that's digging in there. It's just soft. It's the most comfortable underwear I've ever worn in my life. And yes, size up. They say that you could, fit into your pre-pregnancy size. No, I had to size up. Judge it based on how your personal body is changing. But for me, it just was a smart thing to just do one size up. Number 17, the final thing on my list, is that things that work for other people won't necessarily work for you or might not work for you. And things that work for you might be random. And you might have to discover them for yourself. So for instance, the pregnancy tea. I got this morning sickness tea recommended by my cousin, and it was good for the first couple times. It was just a good tea. It didn't necessarily help the nausea for me because, as I've been saying, I have a special kind of nausea, special kind of morning sickness that's not morning sickness. So nothing really worked none of the home remedies really worked for me, but it was a decent tea. Then on maybe the 4th time drinking it, it started to taste like throw up to me, and then it would make me throw up. So the morning sickness tea, the pregnancy preggy pops, the things that they suggest on all the YouTube videos about how to cure your morning sickness. Preggy pop drops, the actual morning sickness candy that they sell on Amazon. I got that. I got them several times, and they were working for me just fine for a while. And then one day I puked one up, and I was never able to eat them again. My husband liked them. They're just a sour candy. It wasn't anything special. It was just a naturally sweetened sour candy, so he finished them off. but I was not able to eat them anymore. And they, like, some women swear by them. Some women swear by the morning sickness tea. Might not work for you, but it might work for you. So again, trial and error. It's all about trial and error. For me, the only thing that worked to help with that metallic taste in my mouth is the cinnamon gum. Pure cinnamon gum. I will link it in the description. I would get them from Amazon because I couldn't find them at any of my stores nearby. So yes, those are my things that I think you should know about your first trimester. I know it kind of slipped into the second trimester there a little bit because I'm in my second trimester now. And for me, the first and second trimester kind of blurred together because that morning sickness never went away. So I still felt like I was in my first trimester, even though I was well into my second. But yes, hopefully you're not like me. Hopefully you don't have mild HG. And I hope that once you hit that second trimester, you start to feel more like yourself, more energy, and less nauseous. Good luck if you are pregnant as well or trying to conceive. Thank you for watching this video. I hope you found it helpful, maybe a little funny, entertaining even. I will be having more pregnancy content on this channel. Also, I like to do like food content, so grocery hauls, cooking videos. So if you like that too, there's some already on the channel and there will be more to come. Subscribe, like the video, that would really help me out. Thank you again, and I will see you next time. Bye!